Okay, so it has been officially 2 years since you and I have both gotten smile laser eye surgery. We got a lot to go through.
Yes, we do.
So since then, we posted like 2 or 3 YouTube videos, and to my surprise, we've gotten a lot of feedback, a lot of questions, a lot of comments. And in this video, we are going to go over all of those issues and topics and just go over what it was like for us in our experiences. Cool. All right. So first thing, I tried going through all these videos and just getting like an average of all the questions and stuff that they've been asking. It's a lot of negatives, a lot of positives, a lot of neutrals, a lot of questions. A lot of people are just questioning the whole thing, and they're like, well, this is a new thing. I'm kind of worried. What do I need to know? So we're going to go through all of that. First question is, what was your prescription/eyesight before going through the surgery?
I can't recall at this moment. I could take a look into my phone and see if I could find it, because this was, 2 years ago? A year ago? Something like that. And I have no idea, honestly, at the moment.
Because actually, I don't know my prescription either. So I will try to put this in the video. Hopefully I can find that, screenshot it, put it there. So I know a lot of people are asking if you have like a bad eyesight. Are you a candidate? What are the requirements? And my best advice is to just go to whoever is local in your area that's offering this procedure, and they will, like 99.9% of the time, give you a free consultation. Because to them, they just want to give you this consultation so that they know if you're a candidate, and if you're a candidate, then they'll most likely take you. So go to your local laser eye doctor, surgeon, get a free consultation.
If anyone has second guesses on going, I honestly thought I want to be a candidate because I'm pretty sure my vision was somewhere in the negatives. And I said, if I'm in the negatives, there's no way that I'm going to have a chance at doing this. Lo and behold,
here we
I was
are.
able to do it.
2 years later. Yeah, so I was nearsighted, meaning that I can't see far away, right?
Same.
That was you.
Same.
So as far as people who are nearsighted, I think it's meant more for you guys. I might be wrong. Maybe farsighted people can do it too. I have no idea. For the record, we were both nearsighted. How old were you when you got the procedure?
So I am 28 now. It's 2 years ago. So it was about 26. But I think it was either right after or I think it was right before my 26th birthday. I think I was actually 25, and then I had just turned 26.
I'm 28 now, so I think I was also 26. Pretty sure I was. And I know that there's like a saying that your eyes aren't fully developed maybe until you're 25. So some people think, is there like too early of an age to get it? Or is there too late of an age to get it? My viewpoint on that is I know someone who's gotten laser eye surgery like at 18, 19 as a graduation present, and they said it was the best present they've gotten. And I think it's really cool to get it that early in life, because that's just like an extra 9-8 years of perfect vision until everybody's eyes eventually start to deteriorate around 40. So I think the sooner you get it, the better. But at the same time, consult with your doctor to see if that's even a possibility. Now, what was your reasoning for getting this surgery?
As you know, that I always flip-flop between glasses and contacts. Contact when I was in public, glasses when I was, at home, in private, right? Because I hate how I looked with glasses on in public.
You look like a nerd, I know.
Amen, dude. You would know. You looked more of a nerd than I did.
I was more of a nerd. I'll give it up.
More of a nerd than I did, brother.
Okay, fair enough.
It was more so just the uncomfortableness and like the inconvenience of glasses, right? When I would get stuff out the dishwasher and it just finished running and my glasses got steamy, or if I had to take a shower, or the year I got the laser eye surgery, I went snowboarding for the first time. And it just so happened that it was a week before I was supposed to get the surgery, so I couldn't wear my contacts and I had to snowboard in my glasses. You already know how that went. Yeah, almost lost them.
Sheesh.
So just more of, I got it just because I felt like it was time. It was just time to get it. It was something that I always thought about, and I said, all right, you know what, you got it first, so you were the guinea pig anyway.
I feel like I was like the domino or the driving factor that really pushed you to like, okay, he got it. He's alive.
He's alive. Yeah. Don't ever watch. I think it's Final Destination 5. Don't watch that one, because there's a scene about laser eye surgery. If you watch that first, you're not ever going to get it. So
I did not watch that.
I highly recommend not to watch that.
Good to know. So my reasoning is pretty similar. It's basically just quality of life. You never realize how much of an inconvenience it is, like have glasses or contacts. I did both. I did contacts earlier in my life, like 20s, and I got sick of it. It was so annoying to always like put them in and your eyes just feel weird and like you're poking your eyeball. So I stuck with the glasses for a good majority of my life. But then I was actually out on vacation, work vacation. I was in Mexico for like a 30-day trip, and it was like the best time of my life. And mid-trip, I thought I lost my glasses. And then it just like hit me that if I lost my glasses, then I couldn't enjoy the rest of the trip because I couldn't see for the rest of the trip. And that was just like a mind-blowing like moment for me. And then after like I found my glasses, it was just like, whoa, I lost vision like permanently. It was like weird. It's like you lost something you never knew you had. But then when I got it back, I was like so grateful for having it, where I'm like, that's the final straw. If there's an opportunity to get full vision for the rest of your life, why not do it? Were you scared before going into surgery? Why were you scared, if you were? And give me some tips for other people that are like thinking about getting this and are worried at the moment.
So when I went into surgery, I wasn't scared. One, because you already got it first. So it kind of got rid of any butterflies that I might have had.
You were there with me.
Yeah, I was there when you got your surgery. I was the one that drove you back home.
You were.
But I wasn't scared when I got it.
There wasn't like the slightest thought like, what if it goes wrong and my eyesight is ruined forever? Because that's what a lot of people are worried about.
I think there were a lot of relief factors I had in my experience, only because one, you got it first, and two, they have a lifetime warranty at the location that we chose.
Mm-hmm. I think a lot of places that offer it give that warranty. I also do think the warranty, I don't know how like it applies to that, like, because in the case something were to go wrong and your eyes are ruined forever, I don't know if they have the technology to fix your eye. I think that warranty is more so like if you went through the surgery, you're good for a year, and then something happened, like you notice your vision deteriorating in that second year, then they would like look at you again to be like, oh, we can fix that. But for me, I don't actually recall being nervous or scared. Like I know we made a whole video on it and I was pretty excited, honestly. Yeah. I think for me, I was more excited because there was finally a way to have perfect vision where I never knew that was an option before, mainly due to like financial costs. But for you, yeah, you saw me do it first. And I think your personality, we never even talked about like the scariness. Like we just weren't afraid. Because the first thing you should do, obviously, once you get your consultation, you review and look up your doctor, your surgeon. You talk to them. You ask them how they feel about this surgery. How many times have they done it? Look at their success stories, the place's testimonials. If you can even like find these people and talk to them, that'd be awesome. Because then you're getting the comfort of knowing somebody else went through it before you, like you did with me. And now you feel more reassured and you just feel a lot better about it. So in both our cases, I don't think we were ever scared. I think we were just excited because we finally can get this done. But I understand if you're going to research this topic, you're going to go on the internet, you're going to see a lot of negative posts. But you're only going to see the negative posts because all the people who've had it done well aren't really posting about it because they're out just like enjoying their life. So for any of you haters out there that are leaving negative comments like, oh, I lost my eyesight or stuff. Well, if you lost your eyesight, you can't watch this video. So I think you're lying. After the surgery, when were you actually able to see again?
I was cautious of trying to see, so I actually had my shades on right after the surgery, as they recommended. When I got home that day, I went home because my eyes were exhausted because after a surgery, you're exhausted. Once I got home, I went to sleep. I woke up and then I tested it to see if I could see, and I could see. I was sensitive to bright lights.
Makes sense.
I was sensitive to bright lights.
Like right away, that makes sense.
Yeah, but it wasn't to the point where it would like I couldn't open my eyes. I just didn't open them completely wide or regular, as I would say. It was more so like a squint.
Yeah. It's like you're looking at the sun.
Yeah, it's kind of like you're looking at the sun. By the next day, I was good to go. But per doctor recommendation, I kept it on for 24 hours.
The shades
for 24 hours.
I vividly remember as soon as I got off of the table, that vision was clear. Like I remember that feeling. I'm like, whoa, this is crazy. Like right when you get out of that operating room, you can see, at least in my experience. I think you could too. But then like after that, they do put those shades on you. And then you're supposed to just go straight home because during the operation, they put numbing drops in your eyeballs so that you don't feel any of the pressure or any of the pain during the operation. And those drops will wear off about 30 minutes after you're done. You try to get home as soon as possible because once those drops wear off, your eyes are going to start itching. At least mine did. Mine were itching and burning and I was crying. So that's why they recommend you to go to sleep right away so you can just sleep through the pain. I don't think I actually slept that night because it was just itching watering my eyes so much. I'm like, my eyes are watering thinking about it. But I was able to see right away. And then obviously the next day when I woke up, burning pain was slightly gone and I woke up and I could see. And that was like the coolest experience ever. Just like waking up, not needing to put on your glasses. Yeah. It was an eye-opening moment, pun intended. Oh, let's talk about what the actual operation was like. Was it uncomfortable? Was it painful? Quick, easy? Like, what do you recall from that whole thing?
Yeah, it was just a quick experience. The only thing I could really think of was, they lay you down on the table. They have this machine, I guess they call it, to keep your eyes open. I think I was on the table for 5 minutes. I mean, I was in the waiting room longer than
Oh, yeah.
Yeah, I was in the waiting room longer than the surgery. Literally in and out.
So they say it's an average of 2 minutes an eyeball. So yeah, 5 minutes.
Yeah, 5 minutes.
Literally.
Yeah.
It was cool because I was able to record your surgery. And if you look back at the photos, footage. It's not gory or gruesome, but it's different. Like, because they're like going in at your eyeball kind of. Like, you don't feel it though, because they put the numbing drops. They put that in your eye. So don't worry about feeling any pain. I do not recall any pain. The only thing I will say is that I remember pressure. You know, when you get if you get like a cavity or something, they'll inject you with Novocaine so it's numb, but you'll still feel the pressure if they're like drilling into your teeth. You feel the pressure, but you don't feel the pain. It's the same thing with the eyeball, but they're pulling something out. I remember seeing like the doctor's hand on your eyeball, like pulling that thing out. So I'm thinking to myself, when that happened to me, yeah, you feel his like fingers on your eyeball, but it's just a weird pressure.
When I was under, I could kind of smell like the burning.
Really? I did not.
I was able to smell the burning of like my eyes, so to speak. Yeah, it was really weird because I was like,
wow, I did not.
Like, sun's getting fried.
That's interesting.
It's my eyes.
I mean, that would make sense. A laser is literally like shaping out your lenticle. Okay, but no pain.
No pain.
No pain. It's quick. 2 minutes an eyeball. You're probably on the table for like 5 minutes. Okay, let's talk about side effects afterwards. Did you have any trouble seeing things up close, things far away? Other issues such as dry eyes, halos? Any issues, side effects after the surgery?
Yeah, so I know we both went through side effects. The one side effect that I went through, I told you, was the starburst effect. And the starburst effect and the dry eyes. The dry eyes comes with the territory because, you know, they tell you that. Just have the artificial tears on hand. And then the starburst effect is what I had only at night. It was like little, like bursts. They weren't like blinking bursts. It was just when you see certain things at night, it's kind of like a star.
It's really common when you're looking at street lamps and traffic lights. Small balls of lights that you are normally looking at night, when you look at them, and if you have this effect, the starburst effect, all you're going to see is those balls. Instead of looking like a round circular object, it's going to look like a star, like just like a starburst, like a sunburst. The other side effect that other people complain about is called halos. I think it's similar to the starburst, but you just see like an extra halo around these small lights. But I didn't have any of those effects. But I will say that I did have a lot of dry eyes. I just remember vividly the morning after, like my eyes were just burning and itching, and I didn't have the artificial tears on hand. The next day, you should go straight back to the surgeon so they can do a quick checkup. And when I went back and told them my issues, they were like, oh yeah, that's normal. You just need to get some artificial teardrops. I'm like, really? That's it? He's like, yeah, and you'll be good. So I went straight to CVS, Rite Aid, got some teardrops, popped them in, and the itchiness went away. I saw some comments saying people couldn't see things up close for some reason. I can't say anything about that because I didn't have that issue. I don't think you had that issue either.
Yeah, I was able to do everything normally. Like I said, the only starburst.
Only starburst for you, like dry eyes for me. And the dry eyes, they go away like within, I say, 2 to 3 months. And if you're consistent with the teardrops, it really helps. How's your night vision? I know you mentioned starburst, so you had that effect, but anything else with your night vision?
Actually, yeah. The day after I went to Red Lobster, I was the second shift, so I would come out by the time it was nighttime, and I drove home perfectly fine. The only thing was the starburst effect. The starburst effect isn't that bad either. You could still tell, like, you know, when it comes to traffic lights and stoplights, like red, yellow, green, stop signs, you can see just fine. It's just a small little like starry burst effect, but that's it.
Yeah. So it doesn't impair your vision. It's just something now that you notice. You're like, it looks like that's weird. Did never notice that before.
Yeah, that's it.
For me, like now that I think about it, I think I was like a little sensitive to lights. Like if it's dark at night when a car is driving past me and their high beams are on, I do notice that. Like I notice it like hit, I'm like, ooh, that's like really strong. Even to this day, actually, now that I think about it, if there's a really bright light, like if it's really dark at night, it's late and a car's driving by with their high beams on and they're coming right at me, I'm like, I do have to like block myself. One, that you shouldn't be staring straight into high beams, first of all. I think anybody would get a little blinded by that. But I noticed that like, I don't like that. So I always try to close my eyes when I see that. Other than that, no issues. This is a question that a lot of people obviously have is, how much did this operation cost? You know, it's been 2 years since we had this done, so no idea what the market looks like now. But at the time that we got it, the average asking price was around $5,000 US. If you shop around and if you talk to your local surgeon, see what they can do. I think like 9 out of 10 times these guys are more than willing to cooperate and work with you and work with your budget, because at the end of the day, they're getting a new customer. They're probably making great margins on this procedure. So like we were able to get our price down to $4,000 US, which I think is a really good deal. It's $4,000 for at least another probably 10 to 15 years of perfect vision. Totally worth it. LASIK eye surgery is a lot cheaper. A couple of our friends got it. I think they paid around $2,000. So it's almost like less than half the price. So Smile is going to be the most expensive. LASIK is probably going to be the most affordable. PRK is the longest recovery time, so not a lot of people do it unless they're not a candidate for LASIK or Smile. If you're a candidate for Smile, get it. If you can only do LASIK, you're still going to be pretty good with LASIK. They're very similar. For anyone looking into this who's in the US, brace yourself for $4,000 to $6,000. Find your local surgeon who actually does it. Look at the reviews, ask them their prices, shop around, see what the other people are doing, and try to negotiate. It doesn't hurt to ask.
Always negotiate.
Always
if
negotiate.
If you never ask, the answer is always no.
What are your favorite positives of getting the surgery?
I don't really think there's any like real negatives to getting this.
You
Mind
personally,
that's for me personally.
Yeah, you have not incurred any
negatives, with the exception of the 2 issues I had right after it happened, which was the starburst effect and the dry eyes. Both went away. Those are the only negatives I have. And those are small negatives, and that just comes with the territory of what we're doing.
You don't have starburst effect anymore.
No.
That went away.
That went away. It went away. And they said it would take maximum 6 months, something like that. I honestly don't know when it went away. It's one of those things where you just realize it when someone brings up, hey, do you still have the starburst effect? I was like, I actually don't think I do anymore, because I just didn't realize that it went away. There are no negatives. The quality of life is better, like you said. I would recommend it to anybody.
I would 100% agree with that. Yeah, I'm in the same boat. It was the best purchase of myself. Yeah, of the best purchase for myself of my life, hands down. It has made life so much better. At this point, it's only been 2 years, but I forgot that I used to wear glasses. And then when I look at myself, like old pictures where I wore glasses, I'm like, oh, I don't like that. Yeah. I'm not a fan. If you asked me if I wore glasses, I'd be like, oh crap, I did wear glasses. Oh, I didn't like that at all. If I asked you if there were any regrets, what would you say?
None at all.
None at all.
For us, I feel like we had a fantastic experience. I have no bad things to say. I know you don't either. You know, some people might have had a different experience. The thing that other people should always be on the lookout for too is don't always try to go for the cheapest, because you may end up regretting that. Go for maybe average or slightly below average. Smile. If you find someone who says they'll do Smile for $2,000 when it's on average $4,000 to $6,000, probably do a lot of research on that. And the research that we did on the doctor was great. So
Dr. Shirag. If you are in the Pennsylvania area, local to the Philadelphia area, you go to Dr. Shirag, you let him know that you watched Hui's video. He might remember this was like 2 years ago, but if you mention that, he will probably give you a discount. Yeah. If not, hit me up and I'll hit him up and get you a discount.
What was it called? Lasik Plus?
Oh,
Plymouth Meeting?
No, Lasik Experts.
Lasik Experts.
Plymouth Meeting, that's where
Plymouth
it was.
Meeting, yeah.
One of the people on the other videos, they said, I just had a consultation with Dr. Shirag and I watched your video. Oh my God, I'm going to the same doctor. I feel so much more relieved after watching your videos.
Awesome.
So it's really cool when people watch these videos and they're like, this actually helped me feel so much better. Like you said, in our experience, we probably had some of the best experiences you can have with this surgery. I've seen the other comments. I've seen some people have negative experiences. I'm sorry for those people who've had that, but I can't relate because we just weren't in that situation. The best thing you could do is just do your research. Like you said, look at the reviews, look at the testimonials, see how other people thought, see their success rate, how many operations they've done. The more they've done, the better you're going to feel. And, just talking to them, you can get a gauge of their confidence. If they're going to steer you away from Smile and be like, just do LASIK instead, it might be easier, then I might not go with that person because they're not confident in themselves.
They're not confident in their abilities. Yep.
But if they're like, oh, you're a perfect candidate for Smile, this is perfect, let's do it, then that makes me feel a lot better. Yeah, at the end of the day, don't skimp out on a surgery on your freaking eyeballs. That's the other thing. Don't go for the cheap route for this. Some things you're better off paying full price for, or even more, just for that extra comfort. You can get your cars tinted for like $50. They're gonna look like crap. After 2 years, everything's been good. Nothing's changed. Like my eyesight's still great. I've had 0 issues. Any last closing words for our members out there? Anything they should know?
I would honestly say, if you're considering it, do your research. Look at this video, look at other videos. Just go for it. Because you can only do so much research. They call it analysis paralysis. When you research something so much to the point where you actually don't take action on it. So you think the more research you're going to do, the more confident you're going to feel. There's only so much you can do. And don't watch Final Destination 5.
Don't watch Final Destination 5. That is Barry's final piece of advice, his final piece of advice. I will say, do the research, watch all the YouTube videos. Watch the good ones. I wouldn't focus too much on the bad ones. Yeah, it's good to know both sides, but if the bad ones are just going to freak you out, don't even bother. Watch all of our videos on it because we do a great job of detailing our experience, going through the journey, having a good time. And you get to see the actual procedure in some of our videos. And that's a view you don't get to see too often. So that's my last bit of advice. Check out our stuff. If you have any questions, leave them in the comments down below. Like the video, comment, subscribe. Cool. Done. That's it. Woo! Good job.